Hey there parents, let's chat about a condition that has been around since way back when ancient civilizations were scribbling on tablets. Yep, I'm talking about 4000 BC when people were just starting to jot down stuff. This brain condition affects millions of people worldwide. But what causes it? How do you identify it? How can we treat it? And most importantly, watch till the end to know how can you prevent it. I'm going to talk to you today about epilepsy. Yep, that's a bit of a mouthful, but it's basically a brain problem that causes seizures. Seizures are like unexpected, uncontrollable movements or behaviors caused by a bunch of electrical sparks misfiring in your brain. Now, seizures can be different for each person, from small muscle twitches to full-on uncontrollable body movements. Epilepsy is when someone has more than one episode of seizures not directly caused by another medical condition such as diabetes or severe infection. Now let's bust a myth here. Epilepsy isn't catchy. It's not like a cold you can pass around. It's often caused by brain mishaps during birth, head injuries, infections, or sometimes we just don't know what causes it. Recognizing the signs and symptoms of a seizure in a child is crucial. Seizures can manifest in various ways, and understanding these signs can aid in providing timely support and help seek appropriate medical attention. Now here's a breakdown of common symptoms or warning signs that your child might experience during a seizure. Staring. Your child might suddenly zone out and stare into space, becoming unresponsive to their surroundings. Now the child may suffer from jerky movements of the arms and legs. Now the child's body may become rigid or stiff during a seizure. The child may suffer from loss of consciousness. The child may even stop breathing or have different breathing patterns such as irregular breathing. The child may have loss of function of bowel or bladder. The child may fall suddenly without any apparent reason. The child may not respond to noise or words. The child may appear confused, especially after a seizure, or may become disoriented after a seizure. Now, additionally, during the seizure, your child's lips might turn blue due to changes in breathing, and their breathing may become irregular afterwards. Your child might feel sleepy or confused. Now let's talk about treatment. Yeah, it is possible to tame those seizures. Around 70% of folks with epilepsy can live seizure-free with the right meds. But here's the thing, in some corners of the world, getting those meds can be tough. It's like a big gap between needing meds and actually getting them out. Not cool. Treating epilepsy means trying to control or reduce the number of seizures a child has. Now, doctors usually use medicine to do this. They choose the medicine based on the type of seizures the child has, how old they are, and whether the medicine might have any side effects or not. Now, these medicines can be given in the form of capsules, tablets, syrups, or in other ways like through the bottom or nose. Sometimes when a child is in the hospital, the medicine can also be given through a needle or tube into their body. Now it is very, very important to give your child medicine on time and as prescribed. The dose may need to be adjusted for the best seizure control. All medicines can have side effects. Now if your child has side effects, talk to the healthcare provider. Do not just suddenly stop giving medicine to your child. This can cause more or worse seizures. While your child is taking medicine, he or she may need tests to see how well the medicine is working. Your child may need blood tests often to check the level of medicine in his blood or change the dose of medicine. Now your child may also have blood tests to check the effects of the medicine on his or her other organs. Now if the medicine doesn't help enough, or if it causes some problems, there are other things the doctor might suggest. Now there's a special diet called ketogenic diet. Some kids might need to follow a special diet. that's high in fat and low in carbohydrates. This can help reduce seizures in some kids, but it's important to stick to this diet very carefully. Now, another way to treat is vagus nerve stimulation. This is a treatment where tiny pulses of energy are sent to the brain through a nerve that passes in the neck. It's for kids who still have seizures even with medicine. Sometimes doctors might think about doing an operation to remove the part of the brain that's causing the seizure. But not everyone can have this kind of surgery. Taking care of a child with epilepsy also means making sure they understand their condition, taking the right medicine, and going for checkups. You need to make sure they get enough sleep, avoid things that might trigger a seizure, and especially keep an eye on them during certain sports activities like swimming. Now let's talk about prevention. Now, prevention is like stopping trouble before it even knocks. An estimated 25% of epilepsy cases are potentially preventable. For example, preventing head injuries can help dodge post-traumatic epilepsy. Now, also taking care during birth can lessen the chance of birth-related injuries causing epilepsy. Getting your child vaccinated to prevent brain or nervous system infections can prevent epilepsy. Living with epilepsy can be a bit tough, but with the right help and care from doctors, families, and friends, kids with epilepsy can still do all the things they love. You should contact healthcare providers if your child experiences more frequent seizures, side effects from medications, or any emergency situation related to seizures such as prolonged or multiple seizures. Finally, thanks for joining me today to understand epilepsy better. Your support makes a huge difference. Remember, knowledge is power. Subscribe for more informative content. Hit that like button to show your support and share this video to spread awareness about epilepsy. Don't forget to follow me on social media for updates and visit drowaisrafiq.com for comprehensive resources. Together, let's make a difference in the lives of those with epilepsy. Stay informed, stay connected, and let's keep making a positive impact.